So today we're going to be talking about adrenal and thyroid health. And one of the things that I always like to talk about whenever we're giving any kind of introduction to these organ systems is the connection. And it's nice to take a step back right at the very beginning and say, how do these all intertwine together? So there's a very close relationship between the thyroid, the adrenal glands, and then especially the ovaries, the female endocrine system as well. So I think about it like a triangle for the body, with that thyroid being on the tip top of the pyramid here. And what we see is when one of these different organ systems is affected, the others will be as well. So a lot of times in female transition times, whether it be puberty or menopause, we start to see shifts in thyroid function or shifts in adrenal gland functions. It's our adrenal glands that really step up when we go through menopause and take over for the ovarian function and help us out with that transition as well. Dr. Bauer, do you have anything to add to that?
No, I agree that when those hormones change is the times that we tend to see the most dysfunction in these glands and organs.
So we always like to think of that. So we don't want to be reductionistic and just think about one of the organ models. We want to say, well, if there's something going on with one, let's take a step back and figure out the connection there. So the thyroid, you guys know, you can just take a second and feel your throat here, and you can feel your thyroid gland, which is just this beautiful little piece of tissue in your throat here. And it kind of goes right underneath the larynx. You can see that soft tissue there that in the pink part of the diaphragm. And it almost looks like a butterfly with two different lobes of the thyroid. And this gland is really critical for regulating our metabolism. So it can either speed us up, or if it's not functioning properly, it can slow us down. And it is involved with cellular communication with just about every single cell in the body, which is pretty amazing. So everything from bone metabolism to how fast your intestines can move, and it regulates our growth hormones and our reproductive system, and can contribute to our heart health, and even influence things like protein metabolism and fat metabolism and blood sugar metabolism as well. So it's a really critical one to pay attention to.
So we're going to talk a little bit about the difference specifically in thyroid, with too much thyroid, which is hyperthyroid, versus not enough thyroid, which is hypothyroid. So in general, with hyperthyroid, there's an increase of metabolism. So all things that have to do with that are going to be increased. So frequently patients will be complaining about heart palpitations, insomnia, anxiety, sometimes to the level of panic. There may be night sweats, and most people will have difficulty gaining weight if they're having too much thyroid, which is hyper. Hypo is exactly the opposite. So there would be low thyroid activity. People frequently complain of fatigue. They may be cold, they may gain weight. There's frequently constipation and depressed mood. And then thinning of hair is also a common symptom for hypothyroid, which is by far the most common. Of our patients, I would say 90 to 95% have hypothyroid, whereas hyperthyroid is a much smaller percentage.
And a lot of people walk around being hypothyroid with that low thyroid function and don't know it. They're not diagnosed. So it's a very commonly missed diagnosis, because some of these symptoms can be pretty vague, like having a lower mood, or maybe just having slower bowel movements and being a little bit constipated, or feeling just a little bit less energy than maybe one normally would. So the function here of the brain in talking to the thyroid gland is that there are these hormone signals that come from the hypothalamus that go down to the pituitary gland, and then we see them looping down to the thyroid. And this interconnection of communication, the reason we wanted to take a minute and talk to you guys about this biochemistry is because this TSH, that thyroid stimulating hormone there that goes from the pituitary to the thyroid gland, is one of the most important markers that we use when we're diagnosing a problem with the thyroid, whether it be too much thyroid activity or not enough. And then there are two important hormones that are released by the thyroid gland. There's T4 and T3. And we like to think about T4 as being the inactive form of thyroid that then converts to the T3. And the T3 is what works within the cells to do that function of the thyroid hormone. And it's important that the body has this mechanism because too much thyroid can be very toxic. And so there's a regulation system that happens with that need to convert the T4 to T3. And we're going to talk about that more in depth here.
So in relation to that last picture we had, this kind of breaks it out a little bit more. So the hypothalamus is primarily releasing the thyroid releasing hormone, the TRH, and this is going to stimulate the pituitary to produce the thyroid stimulating hormone. And this is, you know, probably TSH is something that probably most of you guys are familiar with. Maybe you've had it done on labs before. It's the most common one that you would know of all this. That TSH signals the thyroid specifically to create all these thyroid hormones. So we have in the thyroid primarily is T4, which just trying to read through this here. So the thyroid peroxidase is specifically using iodine to create this T4 in the thyroid, as well as the T3. And like Dr. Molly mentioned, the T4 we call inactive, which means it cannot actually attach to the cells. Whereas once the T4 converts to T3, which primarily happens in the liver, that T3 can actually attach to cells. And it's what makes all of our cells feel like we have thyroid in our body. There's also a reverse T3, which primarily is something that will happen in times of stress. If the body feels there may be some sort of epidemic or zombie apocalypse happening, it's going to save and store some T3 because thyroid is actually critical. You would die if you didn't have enough thyroid. So this reverse T3 is kind of like storage of T3 in case it needs it. The challenge with reverse T3 is that your body can't use it. So even though it's there, it's not actually being able to be used by the specific cells at all.
And then a tiny, tiny bit is converted over in the intestines, 20%. But we don't like to overlook that because it's really important that we have proper intestinal function in order and proper gut health in order for our thyroid to get about 20% of its activity. And so we do think, okay, liver is doing about 60%, but there's more happening in those the peripheral conversion with the intestines being part of this too. And you can see in here, we wrote iodine in red, and that's because in order to convert that T4 over to T3, we have to have iodine. That's the critical step. So you guys may have heard of hypothyroidism that's caused by iodine depletion, and that is a possibility. We see that in certain regions of the world where there's not a lot of iodine in the soil and in the food. We can get most of the iodine that we need just simply by having fish in our diet and having the occasional sea vegetable as well. That's very high in iodine. But otherwise, we're looking at fortifying our food, and that's one of the reasons that Morton's salt, for example, almost always has iodine in it. And that's to prevent these goiters from occurring for people and low thyroid function. So there are two ways that we can test the iodine levels for people if we're concerned about that. One is a urine test, and that's the one that we've used most frequently in our practice, the one that I've used most frequently, at least. And then the skin testing is another way to do that. And that you paint a little stripe of iodine on your skin and see how quickly it absorbs. And it's not as reliable as a test. So usually we're looking for actual levels in the urine. But we don't like to just give everybody a whole bunch of iodine because it can actually induce certain autoimmunity, they believe, specifically with Hashimoto's. So we do want to be careful about taking too much iodine.
The other comment I wanted to make on iodine is I have quite a few patients who who only use natural salts like sea salt, and they don't like seaweeds and other products of food that might have iodine in them. So there actually can be an iodine deficiency even in our country if you're not doing any of those food sources. So just to keep that in mind, even though we think of a iodine deficiency as something that might happen in a different country, if you're not eating iodized salt or any of these food products, you actually could be deficient in iodine.
Right. So with our hormones, we kind of went through this already, just this idea that T4 is inactive and it converts to T3. And we know this is a lot of biochemistry, guys, but stick with us because it'll help us in the discussion, because there's so many different areas that problems can occur. So if you understand what type of imbalance you might be experiencing with your thyroid, it'll empower you to actually treat it. So, and we want to do that as naturally as possible. So if we can understand the cause, that's what it's all about. So with T4, when we're converting it to that active form of T3, we have a few things that are required. We talked about iodine already, but we also have some cofactors, we call them, and several of them are minerals: zinc, iron, selenium. And then we've got some different B vitamins: riboflavin, which is B2. We have methylcobalamin, which is B12. And then we also have B6 involved, and folate, which is not on our little list there. But those are all required, as well as vitamin A. On the other side, reverse T3, which we mentioned kind of as an inactive form of T4 that we see released whenever there's major trauma for a person, that one gets increased when there's a lot of cortisol, so a major stress reaction. If somebody is living with a vitamin D deficiency or an estrogen estrogen dominance, where we have an imbalance of our estrogen to progesterone ratio, those can also cause reverse T3 to be increased. Same thing with not having enough iron storage with that ferritin deficiency. So there's a few different things that can cause that. And one of the most common causes for it in our society is T4 medications. So that would be like supplementation with Synthroid or levothyroxine.
So these are those hormones, again, that we've been talking about, T4, which converts to the T3. One thing that we see frequently is when we do testing with labs, TSH may be normal and T4 may be normal, but T3 may be abnormal. So some of the things that we look at are reasons why that might happen. So we know that this conversion from T4 to T3 removes an iodine. So that's one thing, like we talked about a little bit as far as a potential iodine deficiency as a piece. And we, in the very beginning, we talked a little bit also about where all these things are coming from. And there is a piece of this conversion that's dependent on the bacteria in the GI tract. So if there's any kind of dysbiosis or SIBO or other GI dysfunction, that may also lead to a low T3. And then there's also some conversions happening, like we mentioned, in the liver as well as in the kidney. So if there are any imbalances in those two organs, there also may be some issues with thyroid balance.
So we always like to put in a plug for our healthy probiotics, our flora. We really do not want a dysbiotic flora situation, because we know that's important in particular here for our thyroid with our conversion from that inactive form over to the active T3. And so we really want to make sure that we're having that regulated, because it also is going to regulate our immune response in general. So I love this really simple illustration of our intestinal cells, our enterocytes, which kind of remind me of cake. And then on top we have the frosting, which is this glycosylated network of proteins. And then on top of that, it's like the cherries on top. And those are our probiotics. And remember, pro is for and life is biotic. So these are essential for life. And of course, you know, we're inoculated with these at birth, and we want to be providing the fuel so that our good probiotics can do their job and continue to help us regulate our metabolism and keep our thyroid activity healthy in the peripheral gut. So we've got several different sources, as you guys know, of fermented foods that will give us our probiotics naturally and help us keep that in balance. So things that are dairy-free are things like the water kefir rather than dairy kefir, kimchi, kombucha, miso, fermented soy like tempeh, and sauerkraut being my personal favorite. And then we, of course, have prebiotics, which are like the food for the probiotics. And those are different forms of fiber and a lot of fructooligosaccharides, which are going to be eaten and converted by our gut flora. And so really common sources of those that a lot of us have in our diet are things like the onion family, including our scallions and leeks and garlic. And then we have things like our cabbage and bananas and oats that are very high in those as well.
So in general, when we're talking about assessing thyroid function, you know, when we as clinicians hear patients talk about any of those symptoms that we talked about in the beginning of either hypothyroid or hyperthyroid, we're always thinking in the back of our mind, is this possibly a thyroid imbalance? So usually we would start with a combination of blood work. So we'd be looking at these particular thyroid levels in the blood. We would also do a physical exam and see if there's any enlargement or any goiter or even nodules in the thyroid. And then, like we talked about, we would be very specific about those symptoms, trying to assess how many of the symptoms of either hypo or hyperthyroid might you be having to help us, because all three of them together create a picture for us.
Right. And so many of you have probably had thyroid lab tests done. It's very important to us as naturopathic physicians to evaluate not just your thyroid stimulating hormone, the TSH, and your T4, but also your T3. And that's something that's not always done in the conventional model. But the reason for that, as you can see, now that you kind of understand some of the physiology of the thyroid gland, is that we want to make sure that you're not just making enough T4 to make your brain happy with the TSH level, but also making sure that your cells are actually able to uptake that T3, that active form, and do their job. So there are some people that may, and we're going to go through the different imbalances here, but there are some people that may have normal TSH and normal T4, but still have all of the symptoms of hypothyroidism. And you could see why that might be if their body is not properly converting that T4 over into T3, or if there's something that might be blocking that T3 from being absorbed. And so one of those things that could be a problem would be if reverse T3 was too high, and we're going to talk about that. But also there's something called T3 uptake, and that is a very specific problem for people when they have too much or too low of that, because it affects the ability of that T3 to get into those cells. And remember, like I had said, almost every cell in the human body has a need for thyroid, so for that T3 activity. There's also something called thyroid binding globulin, which is going to be able to bind our thyroid, and we're going to talk about that too, and that's going to affect that cellular ability to absorb the thyroid as well. So there are a few different things that we like to test when we're doing a really good assessment of the thyroid through the blood. And then the other piece that we always like to rule out is an autoimmunity, because that's going to affect our understanding as physicians as far as, do we need to just be treating the organ system, or do we need to be thinking about the immune system, which is potentially causing the imbalance altogether. So there are different antibodies that we like to screen for that. So remember, the TSH is just the brain's ability to say, I feel like I have enough thyroid, or I feel like I don't have enough thyroid. And these levels are going to be inverse what we would think. So a high TSH means that the brain is really screaming, hey, I need more thyroid, make more thyroid. It's a stimulating hormone. So when it's making more, the brain needs more thyroid function. So you're actually hypo. And when your TSH levels are low, it means that hey, stop making thyroid. I've got plenty. I'm in a hyperthyroid state.
So we talked a little bit about this already. While we might do thyroid labs just as a part of screening, it's really important to connect thyroid labs with symptoms that you may be feeling and possibly physical exam, so that we're making sure that we see the whole picture. It is common for patients that we see for thyroid issues to be missed, and for patients to be having hypothyroid symptoms for years and years and years before it's ever really looked into. So that's something that we see all the time. In general, if we were to decide to do some sort of treatment for a thyroid disorder, usually we would keep track of thyroid labs about every 8 weeks until there's a stabilization. And then once things are stable, we would be looking at yearly labs.
So this is one of my very favorite books that discusses autoimmunity for thyroid. And the reason we want to bring up that autoimmunity is, once again, it's a very common cause of a thyroid imbalance. I think there's an estimation that 75% of women that have hypothyroidism have Hashimoto's thyroidism, or thyroiditis. So it is a very important underlying cause for us to understand. And once again, we treat it differently as naturopathic physicians. So we want to be understanding if that immune system is involved. And the hard thing with hypothyroidism that can be caused by Hashimoto's is it can also present at times as hyperthyroidism. So these people might be having kind of a combination of those symptoms, where maybe they're having low thyroid function and yet still sometimes feeling anxiety and heart palpitations, sort of things we would associate more with hyperthyroidism. Graves' disease is a much rarer form of autoimmune thyroid disease, and it's a hyper initiation. So the turned on, and there's something that's called like a thyroid storm, where the thyroid is basically making a ton of T4 and T3. And then we have a burnout of the gland, and these people end up eventually becoming hypo and not having thyroid function. So that one can be very, very acute and more concerning. So most important takeaway for you guys, though, is if it's autoimmune, we can't just treat, or we shouldn't just be treating the thyroid alone. We want to think about it as an immune system imbalance. And so it's really treating the immune system to protect the thyroid tissues, which have been tagged by the person's immune system. So every thyroid patient in my practice, I ask them to get screened for this, because it's just such a critical differentiation for the subtypes of thyroid imbalance.
And we have patients who have been on thyroid medication for years or decades who have never been tested for autoimmune disorders. So that's just as important for us, because if we don't know if a patient has that, then obviously it's not been treated. And we know that by supporting that piece, we'll support the overall health of that patient. And if you don't know if that's an issue, it's hard for us to support it. So hyperthyroidism, like we mentioned in the beginning, this is a much more, it's not as common, but about 5% of my patients have hyper versus hypo. But overall, it's an overreaction of that thyroid system. And frequently, these patients will have really low TSH and potentially high T4 and T3. And again, you know, if this is an autoimmune issue, the autoimmune component needs to be dealt with. That's Graves. Whatever the causes of this needs to be treated. Conventional treatment is frequently, most endocrinologists will suggest either a radioactive iodine treatment or other pharmaceuticals, or removal. I've had quite a few patients who removal was what was suggested, even though that's not necessarily necessary. There's quite a few natural treatments that we have in our list. You can see there, all of those are herbs except for the melatonin. And I actually personally have found that hyperthyroidism is much easier to treat than hypothyroidism, because usually patients respond really well to natural treatments. And of all the patients that I've seen, I've never actually had a patient need to do the conventional treatments unless they want to. Although I do have patients that come to me after they've had conventional treatment done and then we're supporting things. But this is a really important thing. Like Dr. Molly said, it can create a thyroid toxicosis, which can be life-threatening. So it really needs to be evaluated by a doctor.
The other piece with Graves, specifically in hyperthyroidism, is you guys may have seen people who've had Graves, and you can kind of tell because their eyes become kind of pushed out of the sockets, not all the way, obviously, but they look like they're bulging out, and that is a permanent side effect of having too much thyroid long term. So there can be some pretty serious damage that's done to the ocular system and also to the heart if this is not caught kind of early on. So we do really take it seriously, and I agree with what Dr. Bauer said about you know, the natural supportive remedies for this have been very successful in my practice as well, but we do need to take it seriously, and we need to support that imbalanced immune system. So as far as major causes for the hypothyroidism, which we consider to be functional and not caused by an autoimmunity attack, like the Hashimoto's, which we were discussing, we've got a few different forms of this. And it's important for you, if you are a thyroid patient, to understand what your flavor of hypothyroidism is. So the first question is does it have an autoimmune basis? And if it doesn't, then we need to be thinking about, okay, well, what is the type of it? Are we having a problem with the brain, with the pituitary gland sending the signal? Are we having an issue with that conversion of that T4, that inactive form, over to the T3, the active form? Or are we having an issue with not enough of our thyroid binding globulin, which is going to help us to some degree with transport of the thyroid? Or do we have some resistance to getting into the cells because of another imbalance as far as our hormones go, and that being our sex hormones? So we're going to talk about each of these just briefly for you guys so you have a general understanding. And usually what we want to see to understand this really is blood work. That's generally the best way to look at that.
So in primary hypothyroidism, we have actual true dysfunction of the thyroid gland. And assuming it's not autoimmune issue, this is the only pattern that's effectively managed by thyroid replacement hormone. Frequently when we do blood work, we will see a high TSH, and the medical approach is treatment of the T4 hormone replacement of that thyroid. There's all kinds of natural support that we can also do. When we were talking before about all the cofactors and all the different minerals and things that are needed for the thyroid to function, that kind of gives the basis for how we do natural treatments for this. But there's also really great research on some herbs that can help support the thyroid specifically to work better. And they're all listed down there at the bottom of your screen.
And I should say also, you know, we use quite a bit of thyroid medication when we need to with our patients. I find them to be incredibly helpful, and there are several different types of thyroid medications that we'll consider, and really it depends on the individual what they need. If they need that T4 alone, if they need the T3 alone, or if they need a combination of the two, and it really is individually given. So this slide by no means should be taken as somebody shouldn't use hormone replacement. There's a lot of reasons too, but generally with this type of pattern, it's one of the only patterns, this and the autoimmune condition where there's already been damage done to the thyroid itself, are the only patterns that are going to just, in our opinion, really require that thyroid hormone support, whether it's natural through a thyroid glandular or through a pharmaceutical. Whereas these other patterns we're about to talk about can have other components that are added in, and then that can help the imbalance of that thyroid hormone cascade. So let's talk about pharmaceuticals.
So these are just different options when we talk about thyroid hormones. So the quote natural is desiccated thyroid, and there's every desiccated thyroid, there's a bunch of different brands listed there: Armour, Naturethyroid, Westthyroid. And all of those have a combination of some desiccated T4 as well as T3. So the T4 and the T3 are combined, which is really nice because that is what the body really wants, both the T4 and the T3. If you were to do synthetic T4, it's a separate pill and it comes by itself, and you can see the brands, but for the most part, we're talking about levothyroxine and all the brands of that. And then sometimes, especially if there's an issue with conversion or if there's a low T3, we may also add a synthetic T3, which is called liothyronine, and then the brand you may be familiar with is Cytomel. There's also an option to put the two together, T4 and T3, in a compounded system. And one of the main reasons that I have patients asking me about that is you can do extended release and different, you can also do different amounts. Instead of having a set amount of a combination of T4 and T3, you can create specific amounts for that particular patient when you do compounded.
The other piece of the compounded, of course, is that we can make sure that we don't have different fillers in there if there are concerns about any kind of allergies or hypersensitivities. And some of our natural thyroids also come with almost no fillers, so we have that option as well. So this is a nice little kind of just little image that talks about that armor thyroid, and just as a reminder that it does have that T4 and the T3 in it, and that there is still a conversion required unless you're giving a medication with that combined T4 and T3. So that's one of the big benefits for us whenever we're using some of the more quote unquote natural thyroid medications, is that it comes preloaded with that T3 and we're not requiring the body to do that conversion.
So now we can talk a little bit about low pituitary function as another reason why there may be an issue with low thyroid. So on a lab result, the TSH may actually be low, but the symptoms may look a little bit more like hypothyroid, where there's fatigue and maybe coldness and everything is slowed down. Some of the most common causes would be chronic stressors. We frequently see this in hormone changes like postpartum, and if there's an inappropriate use of thyroid medication. And in general, the way we support this naturally is by supporting that pituitary thyroid axis. And there's a list of all the different components of things that we may use to support that, so that pattern would be changed overall. We could actually be treating that cause.
Right. The next form of hypothyroidism is when we have an underconversion, and this is one we were kind of talking about before, where the brain is making enough TSH to get the signal to the thyroid to make that T4, and the T4 is made in an adequate quantity, but then it struggles to convert to the active form of T3. And so what we see in the labs are we may see normal TSH and we might see normal T4. And if we stopped with just testing that TSH and the T4, then we would say, oh, you're fine, you don't have any thyroid problem. But it's not until we look at the T3 number that we say, oh gosh, this person is definitely hypothyroid in their function because the cells are not able to get that active form of T3. And so common causes of this are not having enough of those cofactors that we talked about in that conversion of the T4 to the T3. But also we can see this if somebody has adrenal stress. So there we have that triangle coming back into play. And any kind of chronic infection or inflammation can also do this as well. So we really want to be supporting everything that is used for the conversion of the T4 to the T3 in that kind of case. So we're thinking about those cofactors like those B vitamins and selenium and the zinc and the iron and the iodine, those kind of things.
So then another option would be overconversion. So there would be low thyroid binding globulin. So that happens when there's too much of the T4 from the thyroid converting to the T3, but then there's a low production of the actual thyroid binding globulin. So when that occurs in the body, the T3 can't get into the cells, so the cells are still feeling like they're low thyroid. And some of the most common causes of this are insulin resistance or PCOS and other hormone issues like that. So obviously, if that's the cause of this particular type of thyroid dysfunction, then our approach would be to balance those blood sugars and make sure those hormones are balanced appropriately. And, you know, with a lot of things that we talk about as naturopathic doctors, we're frequently talking about nutrition and exercise and lifestyle support, as well as reducing that hormone overload and supporting the liver that has to process all those hormones.
Another reason could be having really high thyroid binding globulin. So when the TBG goes really high, then we get low T3 and low T4 in the free forms. And some of the causes of that are hormones. So especially synthetic hormones like oral contraceptives, like those estrogen replacement therapies, they can really cause too high of a TBG. And so one of the big pieces of that is we want to really help the body clear that excess hormone that's going to be blocking the body's ability to create those T3 and T4 hormones the way we need it to. And so we try to switch over to a more supportive form of birth control if possible for the person if they're on one of those synthetics, or help them with liver support and other things that can help them clear the excessive amounts of hormones if they're making them on their own, for example, if they just naturally have high estrogens. And so we've listed out some of the different liver cleansing, supportive herbs, and components there that help with something called methylation, which we know can help convert out excessive amounts of our hormones, our estrogen hormones.
And thyroid resistance is another type that we may encounter. So this is where the T3, the active thyroid, and the T4 are actually not getting into the cells, and the cells are resistant to these thyroid hormones. So the labs can actually look normal, but the body can still be feeling like it's low thyroid. The most common cause I see for this is stress, which, unfortunately we all have some of it, but when it becomes chronic or is happening every day, even at a low level, can create some problems with the adrenal system and having high cortisol. But you can also have this with high homocysteine. Homocysteine is an inflammatory marker that we frequently check at least once, if not ongoing, and it's something that we're always aware of for our patients. So if that's high, you could also be having this thyroid resistance. So obviously our natural approach for this would be addressing those issues.
So we just want to remind you, obviously, the apothecary has several of these supportive formulas in there, but of course we'd want to be helping you choose the correct one for your specific pattern. And obviously also with COVID, we're closed currently for walk-in transactions, but you can give Katie or Rachel a call and they can help you with curbside pickup if you need for anything. Like that. So, but let's start talking about the adrenal glands, because that is absolutely critical in regards to our thyroid function and the balance between the two. So as far as our adrenals, we know that they sit on the upper poles of our kidneys, and they have different layers of them, and they're going to basically be in charge of producing different hormones. One has what's called glucocorticoids, and these are hormones, like you've heard of cortisone and cortisol, that manage inflammation, but remember they have the name gluco in them, which means they also affect our blood sugar modulation. We then have our mineral corticoids, and those affect our ability to retain sodium in the body. So there's a chemical or a hormone called aldosterone that's in charge of that. They also have an area that produces our androgen hormones, some of our testosterone and DHEA, especially for women. That's a lot of where our testosterone comes from. And as far as the catecholamines, those are produced in the area called the medulla of the adrenal gland, and that produces these fight or flight catecholamines or hormones that are chemical signalers for major stress response, that excitement that allows you to get up and run if you need to. So that's our epinephrine and our norepinephrine. So these little tiny organs provide a ton of chemical signals for our body and really help our body stay in balance in regards to stress management and stress response, and then also our mineral response with keeping our blood pressure the proper level, with being able to regulate our sodium levels. And then also inflammation, of course, and blood sugar control. So all of these are really critical for our survival.
Do you want to talk about this one, Molly?
Sure, yeah. So this one is basically a little bit of it's an image that's kind of intense, but because you can see the collapse at the bottom. But this is basically what happens whenever we have normal stress going on. We can be in the green zone. We call that the adaptation zone for the adrenal glands. And then whenever there's acute stress, we really start pumping out those adrenal hormones. But if that distress is continuing long term, our body starts to develop resistance to some of those hormone signals that are being pulled out. The cells get fatigued from that. And then after a period of time, our building blocks that we need to create that adrenal response start to wear out. And then we fall into this collapse area. So we used to call this adrenal fatigue. And now we've kind of recoined it as an adrenal imbalance or an adrenal exhaustion. So what that means is after somebody has been just hit with a ton of stress over and over and over, their adrenal glands can no longer respond the same way that they had prior because they're depleted. So essentially with this is kind of just another way of thinking about this. Initially, whenever we have stress, we go into this alarm reaction of having really high epinephrine because we have to be able to run from that tiger or whatever it is. And during that initial response, if it just lasts a few days or even a week or so, we start to lose weight during that time because the epinephrine is speeding up our metabolism, it's speeding up our heart rate. We're not as hungry when we're feeling that kind of initial stress reaction, that alarm reaction. And we also have a depression in our immune response when that happens, which is one of the reasons why we want to be really careful about our stress levels, as we want to keep our immune system stable. And then if that intensity of the stress continues, we start to get into that resistance stage. And that's what I was talking about with those hormones being blocked from the cells. They're not as effective as they once were. And that's where we start to see this high cortisol. And with the high cortisol, we know that we have increase of our blood sugar, because remember, it's a glucocorticoid. So that's going to naturally increase our weight. It's going to also decrease our immune response as well. And it's supposed to be mitigating our inflammation, but too much of it can mean that fluid retention and that weight retention, which does not feel good. And then the final stage is that exhaustion stage, where if the stress is predominating and if it's continuing, say, we're basically at war with the stress, then the cortisol itself starts to dip low. And that's when we see these spurts, these episodic spurts of epinephrine, because the body wants to re-regulate. It wants to bring itself back up to where it was as far as its ability to respond for stress. But we have way less resilience in regarding to stress, and that's where we see people being chronically fatigued, and we see a lot of problems with premature aging issues that can happen from that.
So different ways that we may consider testing adrenal function if you're coming in and complaining of symptoms that sounds like there could be an issue. Obviously, we would be doing a physical exam. And then our primary way of addressing adrenal issues is with saliva. We have a 4-point saliva test that we frequently will suggest you to do so that we can actually measure what your cortisol is doing over a given day. But there are also blood tests that we can look at as far as sodium and potassium ratios, as well as we can test cortisol in the blood. And then depending on what those numbers come back, we would be able to determine what is going on with the adrenal. At the bottom, there's an example of actual disease processes that we do see, but they're not as common as more like the adrenal dysfunction we were just talking about. So Cushing's is too much of an adrenal function, and Addison's is not enough, and those are the most severe cases of adrenal dysfunction.
So with the adrenal stress index, which is what we would get when we do that salivary collection, that saliva collection, what we're looking at is we're looking at every 6 hours for a 24-hour period, what your adrenal glands are doing as far as production of the cortisol. And what we want to see is we want to see a nice rise in the morning, which is going to help wake us up, and then a reduction throughout the day, a nice sloping down. We don't want any spikes showing that we're having a major stress response in the middle of the day, or we don't want a lull in the middle of the day where people feel like they're so tired they have to take a nap, and then a spike in the evening when they need to be going to sleep. Because one of the things we're going to talk about here is that melatonin, which is our sleepy hormone, and cortisol have an inverse relationship. So when our cortisol goes up, our melatonin goes down. So we really need this cortisol production by the adrenal glands to be a nice curve throughout the day in order for us to have our normal diurnal cycle and get our proper sleep pattern.
So we've talked a little bit about these components of how cortisol impacts our body, which, you know, it's in our body. We all have cortisol to some degree. It's normal. It's only when it becomes dysfunctional that we have problems. And some of those problems may be it is supposed to be anti-inflammatory unless it's not functioning the way it's supposed to. It will also increase the blood sugar, like Dr. Amali said. It can increase the potassium and sodium ratio, like we were talking about with the adrenal issues. And it can also increase blood pressure, which is really important to know if you're having any blood pressure issues in general.
So when we're thinking about natural adrenal support and ways that we can support the adrenals, especially if we get one of those salivary tests that are off, if we see it flatlined, we know that people are very, very fatigued. Or if we see it spiking in the evening, we know that they've got a reverse in what we want for their proper sleep and their adrenal function. So one of the biggest things that we go on and on about as naturopathic physicians is routine. So we've found that if we are waking around the same time every day, eating our food around the same time every day, exercising around the same time every day, and then going to sleep around the same time every day, it very much helps our adrenal glands know how to produce that cortisol. And it will help us with not just getting proper sleep, but also with the brain and adrenal communication. So that is absolutely critical and more important, I would say, than any herb that you could take to support the adrenals. So the first thing you have to ask yourself is, am I routined? And we see this with kids as well as adults. We all need routine. So as far as stress levels, obviously that's another big one for us all to work on tackling. We all know that exercise can be really helpful for stress, although that can be taken to an excess and can cause more stress if it's done in excess. So that's really important for our athletes that we talk about moderation with exercise, and with our couch potatoes talking about getting out and doing some movement, because that's going to be critical for adrenal function. Meditation, we know, has phenomenal research for helping with adrenal function and leveling our cortisol markers, and then different lifestyle choices. So that may have to do with sugar intake. It may have to do with our, whether or not we're smiling and laughing and, staying socially active, that kind of thing. Vacation, if we're overworking, is of course a really big one. And making sure that we're taking the time to breathe, because that has such a deep impact on the rhythm of our cardiovascular system and what our brain is thinking as far as, are you safe or not? So the other big piece here in regards to the nutrition component is making sure that our blood sugar is regulated, because we know that when the blood sugar is spiking, if we've eaten something sugary, it's going to eventually collapse. And so when we fall off that blood sugar roller coaster, the body naturally produces cortisol to help bring that blood sugar back up to a stable level so we don't get too what we call hangry or irritable. And so that produces a cortisol surge, which is a hit on our adrenal system. So we want to make sure that we're not skipping our meals, we're staying routined, we're keeping our blood sugar stable and not having a whole bunch of Easter candy, for example, and just keeping things really as stable as possible there. So the other component, of course, is building blocks for our adrenals, for what they need to produce their chemical signalers. And so we see certain B vitamins, specifically B5 and B6, really critical there. Vitamin C is an absolutely critical component for the adrenal glands to function. Magnesium, you guys know that mineral, that's going to be a really important cofactor for the adrenals. We know that our fatty acids, our omega-3s, like our fish oil, our flaxseed, our chia seeds, those are going to be also really critical for our adrenal glands. And then we have our adaptogenic herbs, which are just phenomenal, and I'll let Dr. Melinda discuss those.
So many of you probably are familiar with some of these herbs. Our general category is called an adaptogen, and they help us to adapt to life and stress. And in general, they help to support a healthy feedback loop in the adrenal system so that we can manage the stress. There's quite a few of the herbs, ginseng, ashwagandha, rhodiola, holy basil, licorice, all are super helpful. They're all in that same adaptogenic formula. And the nice thing about having so many herb choices is that, if you don't like licorice, or if if you find ginseng too stimulating, there are quite a few of them that have differing ranges of potency. So we can usually find something that's going to work for you, that's going to help to manage your cortisol levels and help with your energy, but not be too stimulating.
Absolutely. So, and we've got a lot of different choices, of course, at the apothecary for those. And then, there are some that you can have in tea form too, for example, like holy basil is one of my favorites. So that's Tulsi. And that can be something that you have every single day as a safer thing in regards to our adrenal balance. So just remember, you guys, the biggest piece here is you want to treat the cause. So remember the connection between our adrenals and our thyroid, and remember to figure out what your pattern is and treat that cause if there is an imbalance there. So we're going to be doing another doc talk on May 12th, and it's going to be on osteoporosis and bone health for the prevention of that naturally. And that's actually a really great one. So we would love it if you guys could join us for that. And we'll be sending out the registration information for that in the next few weeks as we get closer to May. And I'm going to try to get back to my main screen here. Let's see. There we go. Perfect. So do you guys have any questions for us? Looks like I wasn't able to see the chat during the time. So if anybody has any questions, we are so happy to. Okay, if there are no questions here in the next minute, we'll go ahead and sign off. But we sure do hope you guys join us next month. Oh, So, oh, that's a good question. Okay, so the question is what time of day do you take Cortisol Manager? So Cortisol Manager is an integrative therapeutics product that we carry at the apothecary. And that is one that is very specific for reducing cortisol. So it's one that we really like to only use when we know a person is having a cortisol surge that's inappropriate. So the classic use for me is using it at bedtime if we know from testing that the person is having a surge with their cortisol level at bedtime when they need to be initiating their melatonin. So that's one that often I'll give to people, yeah, just to manage that. Or if they're having a midday spike of cortisol that's inappropriate, I'll use that. Very rarely, I've had to use it for a patient who had extremely high cortisol in the morning and it stayed high all day. So that person was obviously having some pretty severe anxiety with that excess cortisol, and it was helpful to use that cortisol manager for that. But definitely have one of us take a peek at your adrenal stress index labs, and we can give you quantities and timing for that, because that's really important. Great question.
Next question is regarding, can the cortisol level go up in the middle of the night? And of course it can. It's supposed to get up closer to when the sun rises, and it's supposed to go up to help you get out of bed and want to get out of bed with an alarm. But we do see cortisol levels sometimes spiking in the middle of the night. And frequently that's one of the reasons why people might be waking in the middle of the night. So yes, that can definitely happen. And that's something that we can also kind of tease out with testing and with talking with patients about symptoms.
Okay, so the next question is hearing about thyroid health while pregnant and nursing. So absolutely, when people are pregnant, they have a much higher risk, or not risk, but chance of thyroid stuff becoming imbalanced. And the reason there is we go back to that beautiful triangle. When the ovaries are doing something different, it pulls on both the adrenal glands and the thyroid function. And so we have more of a susceptibility there. So one of the most important tests that's done in early pregnancy is on TSH. And the reason for that is we can have some pretty severe fetal abnormalities if a woman is hypothyroid, in particular when she is pregnant. So we always check that usually within the first 8 to 12 weeks to make sure that the pregnant mama does not have hypothyroidism that's not being treated. And that's a standard of care. That's not just us as naturopaths being extra careful about thyroid. That's anybody who does OB/GYN care. As far, or primary care that's managing babies. As far as that goes, if a woman is nursing and postpartum, they also have another opportunity there, because remember that triangle, there was a change in the ovary system and that female hormone system. So there's another potential shift that can happen. And I've seen that many a times, that a woman will have, maybe severe postpartum depression going hand in hand with being hypothyroid. So we often want to test again there. And so with that, it's so critical for those women, in my experience, to keep that thyroid function stabilized, depending on the type of imbalance. Remember, we talked about all those different types that can occur. It is not uncommon for them to need pharmaceuticals during that time, because it's a tight window that we need their body to be functioning as well as possible, so that they can have healthy pregnancy and healthy postpartum time. It can absolutely affect, in my opinion, breastfeeding if the metabolism is off. So we really want to be supportive of that. And generally, I'm pretty cautious about the herbs that we provide during both pregnancy and the breastfeeding postpartum time as well, because most of those herbs that we've talked about do have the possibility of transferring through to breast milk or to baby. So we're very conscious about that whenever we're recommending them. Dr. Melinda, do you have any additions?
Yeah, the only thing I would add is that since most of our patients do have an autoimmune disorder like Hashimoto's, that's another thing to be aware of in pregnancy. And most of my Hashimoto's pregnant moms will end up testing their thyroid levels almost monthly, because they can just change so much with all those hormone surges. Like what Dr. Molly was saying, it's really critical for the thyroid to be in the best shape possible during that whole pregnancy. So it's frequently a more frequent testing than what we would normally do when a patient's not pregnant.
And then, you know, as naturopaths, we go back to, okay, we've got our triangle. Let's support the adrenals. So let's support with routine and healthy, you know, blood sugar stability. Those kind of things make such a big difference for thyroid function for women too, when we're supporting that adrenal function. So we really want to think about whole picture, but definitely not miss anything, because anytime we have transitions, whether it's puberty, pregnancy, or menopause, not to leave the men out of the discussion here, but those are the areas that we start to see a shift potentially with that thyroid function and with the adrenal function. So, any other questions? Thank you guys for participating. We sure do appreciate it. And we will hopefully see you next week, and we'll talk about bone health, because we all can benefit from that. Okay, I'm going to go ahead and sign us off. Take care.
Thank you.